In this video, we will learn about the drug diclofenac, which belongs to a class of drugs known as non-steroidal anti-inflammatory drugs or NSAIDs. The NSAIDs are the medicines that are widely used to relieve the pain, inflammation, and as an antipyretic drug. So this is the molecule of diclofenac. Diclofenac is a phenyl acetic acid derivative. This molecule was synthesized in 1973 by a scientist known as Alfred, and the purpose of developing diclofenac was to prepare a drug that has an excellent anti-inflammatory effect with a very few or very minimal adverse effect profile. So there are two salts that are available in the market for the drug diclofenac. One is diclofenac sodium, and the other is diclofenac potassium. So this hydrogen ion right here is replaced by either a sodium atom or by a potassium atom to make these two salts that are available in the market, that is diclofenac sodium and diclofenac potassium. So diclofenac is an anti-inflammatory drug. It is a non-steroidal anti-inflammatory drug. So in order to understand the anti-inflammatory drug, we should know how the process of inflammation occurs in the body. So this is a very simplified version of our cell membrane. So what happens is that any stimulus, any injurious stimulus to the tissue, and this stimulus, it could be a tissue injury, it could be any bacterial toxin or any viral toxin or any parasital toxin or any stimulus that is injurious for the cell membrane, it causes it initiates a series of reactions in the cell membrane. So with our cell membrane, it has a the composition of cell membrane has a compound which is known as phospholipids. And in this phospholipid, we have another molecule sequestered, which is known as arachidonic acid. So what actually happens that in response to any stimulus, this arachidonic acid is released from the phospholipid of the cell membrane by an enzyme known as phospholipase. So with the help of this phospholipase enzyme, this arachidonic acid is released from the phospholipids of the cell membrane. Now, this arachidonic acid is a very important molecule because it initiates a series of pathways that mediates the inflammation, the process of inflammation. It has two major pathways, the COX pathway and the LOX pathway. This pathway is actually beyond the scope of this discussion. So we will focus on the COX pathway. So this COX pathway or this enzyme, it initiates the production of many inflammatory mediators, which are called as prostaglandins and leukotrienes. Both these mediators, they are very important in the process of inflammation. So the our drug diclofenac, it works here. It inhibits this enzyme, and as a result, all of this pathway is inhibited. So this process of inflammation, it is inhibited here. So we know that what diclofenac does, it inhibits the COX enzyme and it stops the whole process of the inflammation. So this is how it acts as an anti-inflammatory drug and antipyretic drug. I will discuss about the uses. Diclofenac is a very important drug and is used to treat a lot of conditions, which includes dysmenorrhea, the pain in accompanying the dysmenorrhea. So the diclofenac is used in the treatment of dysmenorrhea, the pain associated with dysmenorrhea. It is used in the gout because the gout is accompanied by a process of inflammation. So in the gout, it is used as an anti-inflammatory drug. And in the treatment of migraine, in the osteoarthritis, because in the osteoarthritis there is pain along with concomitant inflammation. Diclofenac is very useful in the setting of osteoarthritis. It is used in the treatment of acute pain in any part of the body. It is used for the treatment of rheumatoid arthritis because here the inflammation and pain occurs together in the ankylosing spondylitis, and in ophthalmic inflammation, diclofenac is used in the form of topical drops. The dose of diclofenac is 100 to 150 milligram per day. This is the total dose in the day, and it has to be divided in 2 to 4 doses. Like, you cannot give it in a single dose, and you divide in 2 to 4 doses, and the maximum that you can take in a day is around 150 milligram. A very important thing to remember is that if the patient has any kidney impairment, any renal impairment, if the patient has any issues with the kidney and the renal function, the GFR, which is the glomerular filtration rate, or the creatinine clearance, which is another medium to estimate the effect of to estimate the function of kidney, it is less than 30, then we should avoid the use of diclofenac in those patients because it can aggravate the kidney impairment. However, there are no dosage adjustments required in any sort of liver impairment. So let's talk a bit about the pharmacokinetics of the drug. This drug is usually taken as an oral drug, but the IV and IM formulations are also available. If the patient is unable to take the drug by mouth, the IV or IM formulation can be used. So in the pharmacokinetics, we basically, or we focus on four things: the absorption, the distribution, the metabolism of the drug, and the excretion. So the absorption is the drug that is taken by mouth, the 50%, it is 50% bioavailable in the blood. It means that when we take the drug by mouth, let's say we took around 100 milligrams, so only 50 milligram will appear in the bloodstream to produce the effect of the pain. So if we're converting an IV to oral form or oral formulation for any patient, we should consider that it is only 50% bioavailable in the drug. And if we take the drug with food, it will further decrease its absorption. So we should not take diclofenac with any food. It should be taken on empty stomach. It has a very wide distribution in the body fluids. It is distributed in almost all the body fluids. The metabolism is hepatic. That means that the drug is metabolized in the liver into the inactive compounds, and then it is excreted in the urine by the kidneys. So the absorption is around 50%. The distribution is very wide. Almost all tissues of the body. Metabolism is by liver, and the excretion is by kidneys. And this is the reason why we reduce the dose of diclofenac in kidney impairment. While it has a wide variety of uses that we discussed here, there are certain adverse effects that we should know that this drug has. So we should always keep in our mind that all these effects can occur in the patient while taking the diclofenac. So the first and the most commonly seen adverse effect with the use of diclofenac is GIT ulcers. It can cause the gastrointestinal ulcers in the stomach and in the duodenum. It can cause renal impairment in the body, and the patients who already have any sort of or any degree of renal impairment, they're more prone to this adverse effect. It can increase the liver enzymes, the aminotransferases that are the biomarker of the liver toxicity. So diclofenac can also cause an increase in the liver impairment or hepatic enzymes. It can worsen the edema in the patients of heart failure. So these are the most common adverse effects that are seen with diclofenac, and we should always keep all these adverse effects in our mind while prescribing the drug to any patient. There are certain contraindications to the use of this drug. So if the patient has an uncontrolled heart failure, you should not prescribe them diclofenac. If the patient already has any gastric ulcers, you should not prescribe diclofenac to those patients. If the patient has any ulcerative colitis or any patient has any gastric ulcers or ulcerative colitis, severe hepatic impairment, severe renal disease, or the patient already has hyperkalemia, we should not prescribe them diclofenac. So these are the contraindications that one must remember during the prescription of this drug. So this was all about the diclofenac. The like video, subscribe to the channel, and stay tuned for more videos on the pharmacology.